Welcome to Absolutely Right, the very first graphology, which means handwriting analysis based podcast show in India. My name is Aditi Surana. I'm a graphologist and a high performance coach. Now, every week we come up with different topics that can help you grow and move forward and learn something about a person by analyzing their handwriting. Today's show is slightly different. On today's episode, we are doing the need of the hour conversation. We have a panel of experts, veterans in their field, who would be talking about their expertise about COVID's journey. So from pharmaceutical background, from COVID warriors, from a psychology background and a yoga background. So we have created all these conversations to make sure that the questions that you and I have about how to go about it, what to do, what will happen if I get positive, what will happen if I do not find the resources, all these conversations, all these questions are answered in today's episode. So let me introduce you to our panel. The first panelist is Dr. Sanjay Arora, who was our guest before. He is the founder of Suburban Pharma. Sanjay's lab was the first private venture that was allowed to do COVID testing, and they have been relentlessly for more than a year. The second panelist on our show is Dr. Ruchi Samdani, who is a nephrologist and currently working as a COVID warrior. She has been on this job non-stop. You know how COVID warriors and all the doctors and nurses and medical professionals are being so kind and have been in this journey in spite of their personal struggles. So Ruchi and her husband both are in this profession, and she speaks about how exactly one can deal with slight damage of our organs if we go through hospitalization, and if things go in that direction, what can you do, how can we build, what precautions we can take, and overall the panic that we have about the situation. The third panelist is Dr. Shwetambara Sabharwal. She is a psychologist and psychotherapist. She talks about the mental aspects. So, the COVID trauma, the lockdown trauma, the anxiety, and how we can change our perspectives and what can we do to alter the way we look at the situation, especially when we get anxious and we get all worked up. Our last panelist on the show is our previous guest, Sarvesh Shashi, who is a young yogi and an entrepreneur. And being a yoga practitioner for more than 23 years, he brings in his perspective with his COVID journey and how pranayama and yoga practice has helped him and how it can help us. So he gives us some tips to look at our lifestyle changes to build our immunity, and in case something goes wrong, how we can recover at the fastest possible speed. Now, all these people are, experts in their field, and they bring in their expertise to help us understand what we can change, how we can alter things, and how we can stay calm, grounded, and stable as possible if we become COVID positive. I hope we answer all the questions that you have about this situation, and this episode turns out to be extremely informative for you. Without further ado, let me invite the panel to join in and let's dive into the conversation. Hi everyone. Thank you so much for joining us today for this special episode where we're going to talk about COVID and how all the things that we can do, all the things we should not be doing, and all of you are expert in your own domain. So again, thank you so much for taking out time. Let's talk about the first foremost struggle that all of us are having about all the confusion that we have. So from your end, when it comes to COVID, what are those two things that everybody must keep in mind? In general, at home, if you're not COVID positive, what you should keep in mind, and if you are COVID positive, what you should keep in mind. Can I just open the floor for anybody to answer?
Yeah, so I think the two main pointers for both COVID positive and COVID negative would be mask up above your nose and below your chin, sanitize your hands. I think these are the two foremost mantras to keep yourself safe and keep others safe as well.
Sure. And we've been hearing it for more than a year now, but still we have to repeat these two instructions over and over again completely.
I agree with Dr. Samdani first about masking. But before that, I would say don't step out if you can avoid. Stay indoors. I think other than healthcare workers who really need to be out there, the rest of us, if you can, please, manage whatever you can from home. I think that's the most important thing. And I'll give you an example of what's happened in Mumbai. End of March, when we saw the spike, our testing demands, went up to more than 10,000 test requests a day. We went up to almost 12 to 13,000 test requests. After the partial lockdown, today the volumes have come down and our test requests have come down to about half of that. So even though our testing capacity has gone up, but the requests have come down, which clearly shows the benefits of staying indoors, of avoiding, stepping out, of avoiding meeting people, face to face. And the other big takeaway from my side is that I think vaccination sometimes has given a false sense of security. People
Why do you
believe
say
that, so people, I think, tend to drop their guard after they get vaccinated. Many people still don't realize that even after vaccination, they can still get infected.
Right.
And they might be asymptomatic. So they won't even realize that they've been infected and they can still be the ones to transmit the infection to others. So I think it gives them a false sense of security that after vaccination, I'll be okay. Unfortunately, that's not the case. Vaccination, the goal of vaccination is to prevent severe disease. It's to modify the outcome of the disease. It will downgrade the severity of the disease, but will not prevent you from getting infected. So I think it's very important that even after vaccination, you continue to follow the norms of masking up and staying indoors as far as possible. So these would be my, top two takeaways.
Thank you. Dr. Shwetambara.
Yeah, sure. I think I echo that sentiment. I'd like to answer your question with one answer in two words, which is individual responsibility. Precautions have been given to us over and over again. It's almost like that's the music that's playing in our head when we're calling anyone, when anyone's calling us.
Right.
But I think the key factor here is to be able to take individual responsibility. If there's any time that we need to do this, it is now.
And all of us should keep that in mind. It's each one of us is playing a role in the larger picture.
100%, yes.
Sarvesh?
No, I mean, I don't have much to say because the three superstars have said themselves and everybody have articulated in a very simple manner on what one should do. Because I tested positive on the 7th of April, in spite of 23 years of yoga. A lot of people thought that, if you do yoga and you're fit, you won't get it, right? I mean, that's another misconception that people are having. But I think God was kind. I tested negative on the 15th of April, which also happened to be my birthday, and with almost no symptoms and no medication as well. I didn't, apart from vitamin C and D, I didn't take anything else. And that I would give credits to yoga of my breathing exercises, etc., etc. My strain was bad. CT value was pretty low. But apart from loss of smell and taste, I was perfectly fine. So I think, like Shwetambara said, that individual responsibility is going to be the fundamental reason of everybody coming out of this together. Because only if all of us, 1.5 billion Indians, are able to take individual responsibilities of whatever it is that needs to be done, whether it's staying at home, staying safe, masking up, sanitization,
Isolation.
all of it. It is, one needs to realize that this is real. If they don't realize that, it's going to be hard.
So I'm going to move to Sanjay. Let's start from the whole diagnostic area and let's understand this whole concept. And I'm curious that if you take a test, it takes around 24 to 48 hours for you to get your reports. So how does that work? Like if you have to get admitted and if you are in that moment where you have to take a call, how does it work?
So Aditi, actually that all labs have ramped up capacity, and the biggest challenge for labs today is inability to predict the demand. We don't know how the demand is going to come up. So we had a capacity of around 5,000 to 6,000 tests per day, and the demand, just suddenly went up. So it takes time for us to ramp up capacity. And that's probably the only time when, we are not able to give back the results within 24 hours. Having said that, I think all labs have now been able to ramp up capacity and most labs are able to give the results within 24 hours. However, there are times when even 24 hours becomes too long and people need the results almost immediately. So there are two options here. One is, you can, so if somebody needs to get admission into a hospital and they are critically ill, almost all hospitals have access to rapid antigen testing. Although it is not as accurate as the RT-PCR test, but yet, it will give you a fair indication. If it's positive, you can almost certainly assume that the person is COVID positive. And it won't give you a false positive. It might give you a false negative. So that's a 30-minute test. It can be done at the hospital, and you can probably get next line of treatment. The other option, which has been introduced recently, maybe a few weeks ago, is a company called Abbott, which has introduced a rapid RT-PCR test. So we first introduced that at the airport for passengers who were arriving, international passengers, and we could give them the results within half an hour. We have now put that machine available at the parking lot of the airport, at a couple of other centers in Mumbai, where you can come, wait for about half an hour, 45 minutes, and get the result. So there are these two options available in case someone needs to do a test in an emergency and can't wait for 24 hours, then these two options can be used.
Dr. Ruchi, I have next question for you. Now, when it comes to the whole, younger population getting infected and the whole struggle that we are feeling, like I was talking to a friend, her 3-year-old got first tested positive, and then the whole family got it. Now, what do you do in situations like that, and how severe? We know the second strain is really, really severe. A third one, how severe it is? What are those real challenges that you're facing?
So, really good and pertinent question, I feel, in the current scenario, because it's very different from what we experienced in the first wave, where the younger population and children were spared. So children being infected, which we're seeing more and more often nowadays, is primarily the responsibility and the outcome of the parents being more outgoing. The parents land up have been either going out or they have to go out to work. I mean, the younger population they are the bread earners. Both they have to take care of the younger ones and the older ones. They cannot be sitting at home for like more than a year now. So as they step out, we are seeing more of infection rate. That's why amongst the children. The fortunate part is that most children, even after they contract COVID, the COVID is fairly mild in them. Of course, we have a very small subset of children who can have a multi-organ inflammatory syndrome. However, that's a really small subset. We have to be more vigilant. We have to be more careful as the younger population. I feel the key in trying to curtail, apart from masking and sanitization, is going to be vaccination. That is actually going to at least going to try and give us less severe infections,
right,
and decrease the mortality and morbidity which we are seeing in the current scenario.
But as Dr. Sanjay said, that in spite of that, we have to be really, really careful.
Absolutely.
Even if we do that. So Shwetambara, next question to you. How are people coping? And I've been working on this anxiety part, and I'm seeing how it is devastating. Not only the situation when you go through the trauma, but the possibility of you or your family member going through it. So everything that is happening in the air and what you see on social media and all the news, how do you deal with it? If you have any ways for our listeners to look at a few things that they can do on a regular basis.
Ideally, I would have liked to address anxiety in an entire different conversation, but I'm going to try and pack this with both anxiety and coping, since you used both those words. I'd like to explain this with an analogy. Let's say we're cooking, and when we cook on high flame, we start to burn the food.
Right.
What are you going to do? Are you going to turn off the gas? Because that's not going to help you cook the food. You're just going to have to simmer it down.
Right.
So the thing with anxiety is that we have to recognize that when it starts to get out of control, when it starts to interfere with our functionality, when it starts to overwhelm us, then it is diagnosable or a debilitating condition which can convert into an anxiety disorder, and coping with that is a whole different ballgame.
Right.
If we are able to contain it, simmer it down, regulate it, and keep it to concern, then we can take the necessary precautions, we can be responsible, we can be compassionate, and even prevent a situation like that. That is an ideal case scenario. If there is anxiety or experiencing anxiety to the point that there is interference in your daily functionality, if there are unexplained emotional outbursts, unexplained physical manifestations, then it is absolutely imperative that you seek some support. Please do not wait for it to become chronic. One of the things that we have noted in the last year and a half is that people who are already emotionally fragile are the ones who've landed up developing full-fledged mental health concerns. And you can't really attribute it to the pandemic. It can be a trigger. It could have exacerbated it, but there were already some undealt with emotional concerns, relationship concerns, or just childhood concerns, and those have manifested in the form of anxiety. As far as coping is concerned, I've always explained the whole self as a triangle of, three sides that lean on each other, support each other, and that's the body, mind, and soul. It is important for us to understand that when we neglect any, the other two will fall, will get impacted. And so it's very important that to cope, we put in a little bit on a daily basis in each of those pockets. The body, mind, and soul come together to make a whole self. And as far as, coping is concerned or wellness is concerned, it's very important for us to invest in all of those three. As far as the current condition is concerned, I'd like to conclude with saying that we have to learn to quickly recover from bad news. You mentioned news, you mentioned, we're also talking about children. They're hearing their peer group getting the disease. There's family members who are contracting it. They're seeing, grandparents being taken to the hospital and back, parents as well. It's a very, very difficult time. There can be many, many triggers. So it's very important that we all start talking in families about how to recover from stress. We have to depart from bad news and learn how to quickly recover. Again, that needs to happen in each of those pockets, like I said, body, mind, and soul. And it's important for us to be able to restore our resources, to be able to go forward.
Now, on that comment of body, mind, and soul, I have to bring in the yogi. He's already smiling. He's like, oh, of course. So, Sarvesh, over to you. In spite of 23 years of yoga.
It's not, of course, it's not me. That's the reaction.
So, when we look at the mind, body, and soul aspect, what are the things, we had initially that notion that your immunity will be built by pranayama and by haldi and other things. In last year's few months, we spent a lot of time, all of us were, hearing things on WhatsApp and other sources. Now, how do you look at it? What can people do according to you?
Yeah, I'll start this off with a quote that Lionel Messi once said. He said that, I trained 19 years to be an overnight success. So everybody thinks that, okay, in 14 days, I will do pranayama and my immunity will get built and I'll be able to fight this whole thing better. Right? Unfortunately, that's not the case. It is 22 years of not just, not just pranayama or whatever. It was eating healthy, clean eating, fitness, workout. I was a professional cricketer, used to meditate for 9 hours a day. I've gone Monvrat for 40 days. I've done quite a lot of stuff at the age of 18. And in terms of that practice is potentially what I believe could have helped me. I don't know, right? I'm not going to say, hey, yoga helped me. No, I'm not going to say that because I don't know. I believe it could have helped me because of my eating habits. A lot of people kind of forget the importance of eating healthy and eating clean and healthy food. I mean, a lot of direct-to-consumer brands have now come up and saying, hey, haldi, ashwagandha, and organic food and whatnot. Sure. And, it's been said many, many years ago, eat dal, eat normal Indian stuff. And when the pandemic happened, if you actually realize what came forward is wash your hands, have a shower twice a day, all of these stuff. These are all basic stuff that one should be doing any which ways. You didn't need a pandemic to make all of us realize that. Sure. But that being said, yes, I do think three pranayamas will genuinely affect and be helpful in these really, really tough times. And not just now, I think you should make it into a lifestyle. And those are Kapalabhati, which is said to be a kriya. Second is Anulom Vilom, which is an alternative nostril breathing. And the third is called Bhastrika Pranayama. And if you're able to do this for 10 minutes every day for the rest of your life, you will be in a fairly good space. And I can pretty much vouch for that because not just me, my mom, my dad, my younger brother who's a heart patient, my brother-in-law, my entire family, right from 11-year-old to my granddad, who's 85 right now, tested positive. All of us, I think probably 55 people in the family plus would have tested positive. All of us have recovered fortunately well. And I think I would give it all to the yoga that they've potentially practiced, the food that they've eaten, etc., etc. And it's not that other people have not done that. And, I know that healthy people have also succumbed to the virus, but unfortunate for that. But as much as you can, we can take care of ourselves. Individual responsibility, very, very shortly and simply said, it will be great. And, body, mind and soul, very nicely put. I give it body, mind and nourish, which is nourishing yourself, right? Which is food. A lot of people tend to forget that. And that's what we say. And before the pandemic, nobody wanted to do pranayama at Sarva. We've taken classes for over 700,000 people right now. That's 7 lakh people. Nobody wants to do pranayama. Now, nobody wants to do yoga. Hey, cut the asanas. Let's get to the breathing. I'm like, you don't need this. I mean, if I trust the doctor, if I trust Shwetambara, I need to give myself, completely and say, okay, now I know you will do the right thing for me.
Right.
I always say, be black or white and don't be gray.
Thank you.
Aditi, I'll just add to that. I completely echo what everybody said, but just to add to what Sarvesh said, that there are many things, which are not in our control. As you said that, the genes you are born with, the mutations of the virus, the behavior of other people, but there are some things which are in your hands. I think that's what Sarvesh is trying to say, and maybe I can just paraphrase that do what is in your hands, at least do what you can do to nourish your body, your mind and your soul. And keeping a healthy lifestyle is in your hands. I don't think anybody else needs to come and prod you for that. You don't need a pandemic to prod you. That can be a regular feature of your life on a daily basis. So I think do at least whatever you can on your own. That's the important message. The rest, of course, you can't control everything, but control what you can.
That's right. I mean, somebody asked me once how many times in a week I need to do yoga. I asked him, how many times do you shower in a week? He thankfully said 7 days. And I said that many times you need to do yoga as well and take care of your health.
So, Sanjay, next question was for you. Do you think people are doing too many tests in the panic that they are in right now, just to make sure that they're okay? And when do you think people should really consider taking a test, especially for asymptomatic patients?
I've been doing healthcare. I've been a healthcare professional for over 35 years and in diagnostics for 27. And, we always believe that diagnostics, has a critical role in medical decision making. And today, it's been amplified, unfortunately, because of COVID, how testing has played such a big role. And testing has been given the right kind of attention that it deserves. But also, unfortunately, that words like RT-PCR, antigen, antibody have become common, but words like IL-6, D-dimer, CRP, these are also other words that have become very common.
Right.
It's unfortunate. And so just to articulate what you said, that sometimes people, along with doing the RT-PCR test, they also go ahead and ask for these other tests.
Right.
Now, those tests are not necessary to be done on day one. I think it's very important that if somebody is RT-PCR positive, you wait for at least 3 or 4 days for the symptoms to manifest if they do. Because if you do the tests on day one and they all come normal, you might get a false sense of security, everything is okay. And maybe 2-3 days later, some things will manifest. So I think there's a little bit of a anxiety, and Dr. Sabharwal can probably answer that better. But I think it's just that eagerness that, I'm getting the test done, I might as well get everything done.
Yeah.
So I think, take advice from your family doctor when to do what test. And like you said, that if you're asymptomatic, you may not need to do any of the other tests. You may just know that you're RT-PCR positive. What you need to monitor is, of course, 2 things. Your temperature, so have a good thermometer at home, and your oxygen saturation, so have a good pulse oximeter at home. These are probably the 2 essential things. The rest, if you take advice from your medical practitioner, you would probably be given the right timings of doing tests. However, when people recover from COVID, we are seeing a lot of post-COVID symptoms that sort of prolong. So cardiac conditions, diabetes, lung conditions. So these are some of the impact areas that you need to monitor for after you have recovered from COVID. If you are healthy like Sarvesh, then perhaps it's okay. But somebody who's got, again, words like comorbidities have become now common language for people.
Yeah.
So if you do have a comorbidity, perhaps you need to be a little more watchful after you have recovered from COVID. So to check your hemoglobin, check your blood sugar, check your ECG, check your lung function. So these are certain things that, again, basic organ functions that you need to check for after you've recovered from.
So, the oxygen deficiency, the way we are suffering and dealing with it around the country, what can people do? Can people really do anything being at home? Is it even possible?
Yeah, so I think a lot of questions are being asked that should I stock an oxygen cylinder at home?
Yeah.
Should I get an oxygen concentrator at home? And I think people are obviously anxious, and especially if you have somebody who's elderly at home, you become a lot more, scared.
Right.
My advice is that if there is somebody in your house who's vulnerable, who has a pre-existing lung condition, perhaps then you may need to invest in an oxygen concentrator. But if you stock, otherwise, the people who are in need will not get it. So I think it's better to let the people who desperately need it first to be given the opportunity, because people who have the resources may be able to stock it, but somebody who does not have the resources but who needs it more may unfortunately not get it because the stocks are limited.
Right.
But if you do have a pre-existing lung condition, that perhaps is one of the reasons, or somebody who's really elderly or unwell or has breathing difficulty, you may want to keep that as a backup. Other than that, I think just a pulse oximeter and a thermometer, these are the two essential instruments that you need to have at home.
Dr. Ruchi, next question is for you. People are coming back from their hospitalization with some degree of lung damage, and it might not be severe, but lung is such an organ that eventually it comes back and you have to deal with the repercussions. So what do you do in that case if you have minor damage or 10%, 20%? So you are technically healthy and out of the situation, but also not.
Right.
What do we do in that case?
So actually what you brought up, Aditi, is very pertinent, because we are seeing a lot of this syndrome, which we call is post-COVID syndrome.
Right.
Where up to 12 weeks post-COVID, they present with various different kinds of manifestations. Lung damage manifests in the form of breathlessness. Then the other things which we also see fairly often is fatigue, anxiety, depression. Then they have a lot of muscle pain, body ache. They can have inflammation in the heart. So as Dr. Sanjay also just said, monitoring would be essential. So things which should be done depending on the kind of symptom you're having. If you're having breathlessness, actually pulmonary rehab or respiratory rehab is the way to go. And pranayama, breathing exercises or incentive spirometry would be a good option to increase your lung capacity. Because what we do see in these post-COVID syndromes is that the lung tissue part of it, depending on the severity, gets converted into fibrous tissue. So
Right.
that much lung is lost, and hence you want to increase the capacity of the remainder part of the lungs. When the heart is involved, especially in someone who has comorbidities, you should consult post-COVID your doctor and get maybe an ECG and a 2D echo and continuation of blood thinning medications. So we have to be watchful but not fearful at all, and deal with all of these, as it's been very nicely pointed out: mind, body, soul, nourish. I think actually this quadrangle, especially for rehab in the post-COVID times, is imperative, and that is the only thing apart from medical investigations which is going to help in recovery.
So here we are talking about the physical recovery. Now coming to you, what are the psychological recovery points, and how do you support a friend, family member who's going through it? And what are those, things we must do to be of not only emotional support, but overall creating mental health for them?
You see that there is a lot of strain that everyone's experiencing. the way we all relate to this strain, whether it is physical, emotional, situational, relationship, social, it becomes a stress or not. It's famously put that nothing is a stressor unless you treat it so. So it's very important for us to start understanding how we relate to stress. How are we going to relate to this crisis? And that will make all the difference. From the smallest change in our life, for example, the way we are connecting with people now virtually, to the biggest, not being able to go out, actually a pandemic out there on the lurk, not feeling safe well within our home turf. So there are a lot of changes that we are faced with, and the way we choose to relate to all of this will make a very big difference in our coping. Like Sarvesh was saying, that Taj Mahal wasn't built in a day. So it's very important for us to start investing in this, not expect miraculous recovery, but at the same time persist with investment in all of those components that I was talking about, which is body, mind, and soul. How do you support someone who's either quarantined or isolated or is affected? It's very important to stay connected with them. I've had experience with family in the hospital, in the ICU, lots of patients in the ICU, their families call, for crisis intervention, where, doctors, intensivists are saying now it's all about a positive mindset. They have to fight back. And that's when we step in. And, it's very important for us to be able to connect with them. The advantage that family has is that you already know them. You know their strengths, you know their desires, you know what makes a difference. So, those are the things that you can talk about. We've had instances where we send the grandfather pictures and videos, of their grandchildren, put pictures up in the room, made posters out of things. So depending on what is important for them, just trying to give them some hope and optimism. Optimism here doesn't translate into showing them an unrealistic picture or a positive mindset alone, but just to be able to communicate that tomorrow can be better. For that, we have to fight and persist today. Now, all of these things are easier said than done. When it comes to psychology, this is exactly the challenge, that it takes us time, to be able to establish that relationship and to be able to get some results. So in terms of coping, I think the primary environment that we have is families. It's important for all of us to start having these conversations at home, to be able to support each other. Also, in terms of prevention, God forbid if this was to happen, how are we going to collectively support each other? What are some of the things that we can already plan, be ready for, so that God forbid if someone was to get sick, we can provide the necessary support. Motivation and optimism is key. Help them restore their belief in the fact that they can make a difference. Dr. Sanjay also spoke about it, that there are certain things that are in your control. Anxiety is a result of us trying to control what is not in our control. So this is really related to that concept, just looking at what is it that you can do in the here and now. What is it that you can do in the present moment? How can you contribute towards your health? And I think that is key to communicate to anyone who's contracted the disease.
So you're also saying that be optimistic, but be practical. Do not miss on the fact that whatever is in front of us, we have to deal with it. And whether we like it or not, we will have to deal with the repercussions or consequences of our decisions.
Absolutely. That is how I differentiate between positive thinking and rational thinking. Because if you're a positive thinker, you just sit back, not bother about precautions, not bother about being prepared. But if you're being rational, being optimistic, you're not giving up on the individual responsibility you have for your own health today, and for that of the others.
Well said. Sarvesh, I have to ask you this question. People who have gone through COVID journey and now they are on the other side, there are challenges of weakness and they want to recover faster. Now you have already made it clear that do yoga every day, and these are the few pranayams that one can pick up. What other things that you would recommend? When you say nourish, when you say other aspects, what do you have in mind?
Just one point I'd stand corrected, not do yoga every day, do pranayama every day. When I mean pranayama, pranayama is a part of yoga, yes, but maybe people listening out there have different notions. Breathing exercises in very simple terms every day is fantastic. A physical exercise, you can choose anything of your own. It could be cycling, it could be walking, it could be yoga, it could be gym, it could be anything. But take it slowly. Take it slowly. Do not rush into it. I must tell you, even me, I'm not at my optimum fitness levels today, right? I mean, there is no two ways of not wanting to accept that. Like Shwetambara said, optimistic thinking, positive thinking versus rational. In Sarva, we call it be positive. It's okay, but don't make it toxically positive. Like, hey, I can fall down from a 20-floor building and I'll be fine, right? You have some other words to that, right? It's not positivity. So I would say take it easy. Give 30 minutes. I always in simple terms, I give very easy 3 tips for anybody. 30 minutes every single day for yourself, for your health. Every single day, right? When you get on a plane, air hostess first say, during a turbulence, wear your mask first, then give it for others. So self-care, self-love comes above all. So number 1 is 30 minutes for yourself. Number 2, again, very simple, 3.5 to 4 liters of water every single day. Simple things that one can do to take care of themselves. 3 is if you can eat dinner early at 7:30ish, between 7:30 and 8. Yes, a lot of people are in night shifts, etc. But early dinner will really be helpful. These 3 simple tips can really, really change your life. And I mean, there are multiple other things, right? Right from what food to eat, what diet you need to be on, what are the exercises for your body, which part, if you have an ailment, what to do, etc. But I mean, those will depend people to people. But these 3 things that I continuously say are what I just said, right? 30 minutes for yourself, 3.5, 4 liters of water every day. And 3 is if you can have dinner early, it'll be fantastic. And I would also add one thing. There's a big difference between love and compassion as words. Love is, I at least in my personal opinion, it's 2-way. Compassion is 1-way. And if you're able to be grateful in life for the food you have on your table, the roof you're sitting under, and for the people you have with you is great. Because my Guruji always said that as long as you're breathing, don't worry.
Yeah, but COVID has taken away that one right of breathing away from us. So definitely, that's why I think people are also as concerned as they are. We are at a point of concluding our conversation. But before we go, I want to ask you, in last 1 year, if there is one moving experience that you have had, something that was transformational, something that was, really, really grounding for you, or change the way you look at life. Can you share some small experience of it all?
There are so many experiences, but this one particular incident. So this was when there was a complete lockdown, and we were one of the first labs that were given the permission to do testing.
Right.
So there's this guy who comes to our neighborhood on a cycle, and he supplies bread and eggs and basic food items like that.
Right.
He somehow got to know that we were doing testing, and I'd actually connected with him for something which Sarvesh would like, because whenever he would come in the evening to supply eggs and bread, I would see that he has a phenomenal physique. So I actually started chatting with him, and and he used to go to the gym after midnight every night. Now this is a guy who is working all day to supply egg, bread and things like that, but he made it a point to go to the gym after midnight, and he would show me his videos of working out and things.
Wow.
So I really connected well with this young fellow. So he reached out to me and he said that, can you help me get tested? So he said that none of the buildings are allowing me to supply that because I'm a risk to them. So I said, don't worry, we'll get this done for you. So, the impact of doing a small test for us had such a huge impact, not only on him. So of course we did the test for him. At that time, the test was very expensive. So we, whatever we could, would discount, we did that for him, and it came negative, fortunately. Now he was armed with that report of him being RT-PCR negative. So not only did he, start his own livelihood of supplying that, but because of him supplying food, it helped every apartment, every person in that neighborhood to get access to food. Now, just a small test could have had such a big impact. I mean, it's left a lasting impression on me that, we just take so many things for granted. And this man, I just connected with him so well. He's now, of course, gone to his native place. So I'm looking forward to him coming back and, continuing my conversations with him.
Thank you so much for that story. Thank you, everybody, for your time and being so generous with all your expertise and your insights. And thank you so much again for your precious time. And thank you for being on the show. Each episode is built in a way that you get to learn something about yourself. This time we thought you should learn about things that you must do so that physical and mental health is covered. We have this humongous challenge in front of us, and we can't simply deny that we need to build different kind of skill set, toolbox to tackle and handle the situation. If you're still worried about certain things and if you want to reach out to these experts, their details are mentioned in the description box, so you can check out, you can reach out to them. And if anxiety is your concern and if you're feeling completely bogged down by all the emotional challenges that you're going through, and especially in the lockdown, people are getting really, really worked up. Now, in that case, you can join our social initiative, which was going on for last 21 days. This particular workshop is designed for you to use these powerful tools of graphotherapy and handwriting journaling for you to discover certain aspects of your anxiety. Now, this workshop is available for free on the link aditisurana.com/lockdown21. So make sure that you go through the process, learn things about yourself, and alter the way you look at the situation, you look at the problem, look at everything that worries you, bothers you, and makes you anxious about COVID. I hope we have given all the resources required. I know the time is tough and we have to fight with it together. So this was our attempt. In any way, if we can be of help, please let us know. You can reach out to me on my Instagram handle at Aditi Surana, or on our email ID write, which is WRIT @aditisurana.com. Things are difficult and we cannot deny that for sure. But if we start looking at things which are in our control, things that we can do, things we can alter, and we stay stable as possible, then we might not be the result of the situation outside. We'll be able to create the newer environment in our minds, tough as it may sound. This is the need of the hour, and we have to rise and do whatever it takes. I will see you on Friday with one more episode of the Absolutely Right podcast. Till then, happy writing.